sure. There's no reason it shouldn't. We'll see what happens.
I'm on the pill.
I'm on the pill.
I'm on the pill.
I'm on the pill too.
But it's not birth control. It's Truvada for PrEP, a once-daily prescription medicine for adults that, when taken every day, along with using safer sex practices, can help lower my chances of getting HIV through sex.
I use condoms, but I talked to my doctor about doing more. He said that because I had a higher chance of getting HIV through sex, Truvada for PrEP could be an option for me.
She also told me that Truvada alone may not keep me from getting HIV, and it does not prevent other STIs or pregnancy.
You must be HIV negative to take Truvada for PrEP. So you need to get tested for HIV immediately before and at least every 3 months while taking Truvada.
I wanted to know about all of my prevention options, so I asked my doctor about Truvada for PrEP.
We're still HIV
If you think
negative.
you're exposed to
Serious side effects
HIV or
can
have
occur,
colitis,
including kidney problems, kidney failure, and bone problems, which may lead to fractures. Rare life-threatening side effects include a buildup of lactic acid and liver problems. Tell your doctor about all the medicines you take. If you are pregnant or breastfeeding, or if you have kidney, bone, or liver problems, including hepatitis. If you have hepatitis B, do not stop taking Truvada without talking to your doctor. Common side effects include stomach pain, headache, and weight loss. Ask your doctor about your risk of getting HIV, and if Truvada for PrEP may be right for you.
I wanted to do more. That's why I'm on that pill. Truvada for PrEP.
So what diversity did you see, by the way, in that commercial? Give me an idea of what types of populations at risk did you see in there, if you recognized. You did? Okay. Transgender. And transsexual, which I heard is one of the 50 subheadings for the transgender community. I have background in most chronic disease states, including diabetes, erectile dysfunction, asthma, COPD, migraine, depression, osteoporosis, cardiovascular. I think I met Dr. Underwood because I used to have all the cath labs with the heart attack victims at every hospital in Georgia. So I used to wear scrubs, talk to the interventional cardiologists that were part of SCI, which he'll tell you is the Society for Cardiographic Angiography and Intervention, right? Right? So you be in a death sentence, you lose it. Raise your hand if you heard that before. Raise your hand honestly if you're willing to admit it, that you were ever a little fearful of somebody passing on HIV, or maybe had a misinterpretation in your mind of how HIV is transmitted or anything like that. Raise your hand if anybody in the group. Almost everybody in the room, right? So this is good audience participation that I really appreciate, and it's important for us to be honest with ourselves, right? Because that shows you, don't worry about the medicine. I'm not here to sell anything, even though it's good stuff. The idea is I want you to see how the face of HIV is changing, and many people have already told us that they never thought they'd see commercials like this on TV. And by the way, if you want to see more about what's impacting many people affected and at risk of getting HIV, is anybody who wants to show codes? But there's a lot of surprising, hopefully appreciated things that you might be interested in hearing that we could talk about another day. And here's the thing, I don't know if you noticed it on my bio. First thing you probably noticed in the picture is, dang, he's white. Then the next thing you probably notice is he has a lot of gray hair. And then the third thing you might have noticed was I wasn't in a suit or anything. I was sitting on a hillside, right? I don't know if anybody looked at the bios or read them or anything, but I'm on a hillside in Haiti where they're building their first hospital in a mountainous, jungle-like community. My wife, daughter, and I just did a mission trip. And it was a different kind of mission trip based on that book I gave you, where we don't come in and say we're changing everything. We partner with the village leadership. They put in half the effort, we put in half the effort, we come to a consensus on what we're going to do. And this is going to be the first hospital in Haiti in the mountainous area, not in a major city, right? And I would argue, I don't know who's been to Haiti or knows people in Haiti or has family there. Wrap this, you get off the plane, it's like starting with that word trauma. I think you'd agree there's a lot of trauma, hurt, pain, shame, blame, fear, guilt, stigma, and isolation that's going on in people's lives, not even those necessarily most at risk for HIV, but it impacts those communities a lot. And I'm trying to do the flip side with my bio that we talked about around love, life, hope, pride, joy, grace, peace, purpose, legacy. 9 words that I think cancel each other out, but unfortunately, a lot of people's lives are often stuck on one evil side of the equation, I might call it, where they're trying to shift over or move more toward the one that's going to bring them out of the struggle, right? And so I don't know how you all feel about that, but when I share words like that, do you feel like that happens a lot in the communities at risk? We have a lot of the trauma, a lot of the hurt. I see a lot of heads nodding, right? So my point being, medicines are great and we have good ones, but it's really going to take us loving and hoping for one another and not passing the buck. And if we see anybody at risk out there, or it might be in a risky situation or environment, don't expect that, hey, the next person will help them take care of it. We got to start to do it ourselves, right? So let's get into it a little bit with the last bit of time. You're going to hear acronyms out there: PrEP, P-R-E-P, PEP, P-E-P, and TASP, that most people even doing HIV work often haven't even heard much until lately. TASP is called treatment as prevention. I showed you the first video because that's kind of our opportunity to show how people living with HIV can do their fair share to love themselves and others, because when you're using treatment as prevention on proper medical and other therapy for HIV, now we know you can barely ever have a chance to pass on the virus to anybody if you're keeping up with your medicines, right? And you're not missing your doctor appointments and that kind of thing. So that's the people living with side of the equation, but what about those that want to stay virus-free or negative, right? And so that together we can keep down the community viral load is what we call it, which means we can kind of be kicking HIV's butt even before we find a cure, because if everybody's putting you under, right? So I say anybody who's living with, but the idea being is that when we talk about all this, we got to realize that in HIV, the trauma and such that people feel often and that have dealt with, it often overcomes the coping mechanisms that they were ever born with or developed in life. So it's not like we can say, let's just fix a switch, change a behavior. Why can't somebody stop doing that? Or I don't like what they're doing, or what they're doing is this or that, right? But on the post-exposure prophylaxis side, that emergency situation, there might have been a rape, a needle stick, there might have been substance use or not knowing somebody's status in a sexual encounter somehow the night before. Now you go to a hospital ER and you're saying, how do I prevent transmission of possible HIV? You need full therapy for 30 days within 72 hours. So that's different than PrEP, which is a pill and a strategy to not be put in a situation to prevent HIV, everything on the front end so that the virus isn't transmitted to them so that they could do their part also. So this Truvada medicine actually has two medicines in it, but it has one name. And here's one thing to remember, if not much else. These medicines in this drug go all the way back to 2001 and 2003. They're some of the most studied medicines in the history of HIV. Don't let anybody tell you that this stuff is too new and we got to work out the quirks, but because before it was approved for prevention of HIV transmission in 2012, it was one of the most used medicines that we added other drugs to treat HIV itself. And it's way harder to mix medicines up while somebody's being treated for something than for somebody that's virus-free, that's not sick or has anything going on in the first place. Does that make sense? In other words, it's way harder for me to add a medicine to a diabetic's regimen than for me to add it to somebody who doesn't have diabetes or anything going on, because there's way less chance for drug interactions. It's not as complicated because there's not quirky stuff going on. So we know that there's still 40,000 new cases of HIV every year, but at least this isn't the death rate we had at our peak in 1995, and it's never looked back on trying to devastate, unfortunately, the black community as well. The stats in 1995 were blacks were 14% of the US population with 40% of the cases of HIV. The death rate across the country was 50,000 cases a year death rate in 1995. This is 40,000 new cases, not even a death rate. So we've come a long way, but there's still a lot of work to be done, right? So the idea being, it's going to keep bringing up in the slide deck, ask your doctor these important questions, because guess what, everybody? What's the number one killer of everybody for the most part out there, other than we all got to go from something, and it's usually probably going to be cardiac, to give you a hint. But what is one thing that nobody wants in their lives that's probably the number one killer of those living with HIV or AIDS to the grave if we have HIV? So who has any answers for me? What would you say the top two killers of people most likely with HIV are? Because I'll give you a hint, it's not HIV or AIDS anymore.
Suicide?
Suicide could be one, because people, the diagnosis is so devastating, which is an important piece. What else would you say? Give me one more. What's that? Medicine? Not taking it, right? So maybe not treating it properly, right? What else? Finances, right? We give most of the meds away for free with anybody that can't afford them, so we take out that answer, right? But that's a good try. So here's the deal, right? There's two main answers: isolation and smoking cigarettes. How's that? Does that surprise you? So we could spend a whole lot of time on that. The doctor will probably address some of this, at least the smoking side. But smoking cigarettes is the most dangerous thing you could do living with HIV, pretty much, other than not taking part of isolation. Because if you're out of isolation, you're communicating, you're linked to care, and you're having honest, authentic discussions without a mask on, and you're taking that veil of secrecy off and being honest about what's going on. I've already heard comments today about I don't tell my doctor everything, or let's hold back, or this kind of thing. That trust has to be built in, because if that's going on, we can handle any side effects that come up, and you're never going to probably ever deal with the rare serious side effects that could happen, that scare some people but barely ever happen, that we still have to talk about. And you're going to be in good care, so you're going to be healthy, right? Because when you're the holy grail undetectable in HIV, which you probably don't hear that word a lot or know it if you don't do the work, but undetectable is that getting the virus pushed down so they're virologically suppressed, so we're kind of in control of the virus versus in control of us. You're way healthier. You have less chance to transmit, as we've already covered. And the other thing is you can be on the newer medicines in most cases as they come out, because that's the safest way to switch from one therapy to another, because HIV is very mischievous and tries to change itself to protect itself, almost like artificial intelligence, right? So this pill, you can see it up here, but basically the idea is if you take this pill and you're on the PrEP strategy, probably a 90+% chance you won't get HIV. So then we're funneling down, and then you know that you get tested every 3 months. Well, by getting checked every 3 months to make sure you're virus-free, you're also along the way going to get your labs checked. We're going to know you're safe no matter what side effects we bring up, right? So all that stuff kind of plays on itself, and I better wrap up. So here we go. So things you should know, it's going to keep mentioning virus-free, this kind of thing. The age just changed. It's adolescence now, so 12, 13-ish years old, right? 77-pound body weight, so I don't remember the exact definition of adolescent. Who knows what that is? I know it's right around that age range, but don't quote me, right? But it used to be 18 years old, so now we can impact even more people in terms of transmission, right? Now what it's going to say, serious side effects. It mentioned in the commercial hepatitis B. That's not a side effect of this medicine. Anybody out there living with hepatitis B reacts strongly, very strongly, to ever jumping off medicine cold turkey without telling somebody about it. Hepatitis B medicine had nothing to do with HIV treatment or prevention. You can't stop that either without telling somebody and being weaned off, per se, because you could get hurt from a flare-up to your body, right? It already talked about in the commercial also the typical side effects of, you might have some weight loss or some stomach upset or headache. That's in about roughly 6% or so of the patients, and then the same number of people dropped off due to side effects on the sugar pill placebo. So it has a fairly similar profile. We don't ever play down side effects, but it's not near as burdensome as some people might think, right? And then for the serious side effects, we'll hit in just a second, so we're just going to take about 2 more minutes. But this is the slide I kind of wanted you to hone in on. So let's get everybody to stand up real quick before I close down. Do me a favor, unless you can't or don't want to, what have you, or even are looking for help, right? We don't want to pigeonhole anybody. We don't want to stigmatize anybody. So if you're not on this list, it doesn't mean we don't care about you. If you are on this list, it doesn't mean you're any less worthy of somebody else. I personally believe we're all God's children. He loves us equally, and if somebody feels different, you don't know why Christ came here in the first place. That's just my quick view, right? Amen. So here's the deal, right? So the deal is this. The government outlines, okay, this is the easy part of the discussion. Of course, we should have a conversation if somebody's having relations with somebody living with HIV. And that's where a lot of people stop having the discussion, even providers. They're like, oh, I can bring somebody in that's their partner or partners in their sexual network, because sometimes it's 1, sometimes it's 20, right? And I can talk to all those people, right? But the next one it talks about, it's a little confusing. It's if you're in a place geographically that has a higher incidence of HIV, and I showed you the map. Now it's a not yet. If one of these pertains to somebody you've ever known, heard about, and just think about people you know out there or in your community, in your church, in your sexual network, friends, family, whatever. And what I'm going to have you do, I'm just going to list the very first one, and I want you to watch. Anybody sit down if you've ever known somebody, and I'm going to add the scare of, rather than just treatment for a sexually transmitted infection. Sit down if that's ever gone on around you, somebody you knew, heard about, anybody out there that ever had a scare of or a treatment for a sexually transmitted infection. So we got 90% of the room with the first bullet, right? In most rooms it's 100%, right? So in other words, I'm just showing you already out of the gate, we can all have this discussion with somebody, because all of you know somebody at risk of getting HIV, right? But we can never let anybody ever live in this. They can't afford the medicine, that people don't care about them, that they can't get in care, that they're not loved, right? And that side effects are going to hold them back, or else we're really holding them back for what we call the prevention and the treatment cascade. So I really appreciate your time. I love all of you, even though we haven't met, and I hope you love everybody around you too. So I'll talk to you soon.